So we are talking about a case of a 2.5-year-old child who was who came to us as his main problem as hyperactivity, and then was diagnosed as a mild autism spectrum and ADHD. It came somewhere in between. That's what the pediatrician diagnosed it. So let's see. So I'm going to tell you the case in the beginning, and hopefully towards the end of the case, it would be interesting if you could tell me what could be the possible remedy. So what are the main complaints? These complaints are mainly given by the parents, and the parents say that the child ignores the talks of the mother, just doesn't pay attention to anything, and is often just thinking absent-minded, or would be keeping on thinking about something, looking at one place for a long time. If we try to teach him anything, he ignores, and this is something that has been noticed for last 1 year. He doesn't respond to anything. There's a total lack of reaction. Although he tends to be very restless at night during sleep, and very generally hyperactive and restless and throwing things and striking. He gets very aggressive if something is not given to him, and he can even hit. He gets very, he it's an idea that kind of he shows across that he gets very less attention from parents, so he's very attention seeking in that way. Very restless, doesn't sit in one place. And in this kind of cases, and in majority of these cases, we give, as you know, in homeopathy, a lot of importance to mother's history during pregnancy. The mother says that during pregnancy, her sister-in-law died, and that kind of was a stressful situation, because the sister-in-law died, all family members came to her house. And in Indian culture, when many family members come to your house, you have to end up cooking and cleaning for everyone. So she ended up cooking and cleaning for everyone on her own. So there was a lot of exertion. And she says that, my problem was I didn't want to do it, but I couldn't express my emotion. I couldn't tell them I can't do it, I don't want to do it. I'm a very mild person. So I didn't have a good relation with them, but I didn't know how to express what I felt. And that kind of, I think I suppressed a lot of my emotions. And I don't know why. I think that affected me a lot. So can you go a little deeper and tell me what was your main feeling and experience? It says that nobody gave me importance and no one pampered me. That was my felt. That's what was my main feeling. No one to pamper me. I felt like leaving. I felt like going away. Because maybe I didn't feel proper importance. I felt no one is valuing me. No one cares for me. There is just no one. I'm totally alone. No one to help me, no one to guide me, no one to care for me, no one to support me. Just no one there. Totally alone. Totally no one there with me. The only dreams that I would get is of God. I would keep on getting dreams of God. Lot of anxiety, I had a lot of anxiety during pregnancy. Anxiety about what will happen in the future, about family members. I had a lot of fears of animals, typically dogs, cats. I was very scared. I also had a lot of nausea during pregnancy. Tell me a little bit more about your basic nature. I feel that I have a lot of anger within me, but I tend to suppress myself a lot. I think somewhere I'm not able to express my emotions. I think that is one of my main issues. I am not able to express my emotions too much. I feel no one values me somewhere. I feel that no one is there for me. No one gives me importance. Maybe I've kept so many things inside me, bottled up so many things that now I don't even remember. I don't know. My mother-in-law would treat me very badly. She would she would scream, she would say things. It would affect me a lot. It would affect me a lot. And it was strange, because she would treat different people differently. And I think emotionally it hurt me a lot, probably. A little bit more about the child's nature when I asked to describe. She said the same thing, that although very, very hyperactive, has become very aggressive nowadays. Physical generals, lot of sweat on the neck, on the scalp, very thirsty, craving for sour, lot of craving for sour, uh, sleep position on sides, the sleep is refreshing, very thirsty. The one thing that when I asked, from childhood till now, and this is a very important question I give, childhood till now, what are the main symptoms that you know about the child? And he told me that the main symptom that we have seen is that recurrent boils. We have seen that the child has recurrent boils. The boils, frequently keep coming to him. The child, she said, that generally the child is very happy when we take him out or we are traveling or something. He is in a very, very good mood. So, plain gentlemen, this is the case in short. All right. So I'm just opening up for some thoughts about the possible set of remedies. So feel free to tell me the possible set of remedies and the reason why. You know, one of the main things that I've seen with because I've been teaching and treating for last many years now. One of the main things that I've seen is that as homeopaths, we are very keen about going towards themes. And we think, okay, a person is very insecure, it is possibly calcarea curve or something like that. This is where I want to teach you the steps, the technique of repertorization. So that's what I'm going to do right now for you. How to repertorize. Let's see. So let's see this. How to analyze, how to convert patient language to rubrics. Someday I will just teach you how to repertorize. What is the main rubric in this case? That the development is arrested. So first rubric, arrested development, which means that there is slowness in the development. Number one rubric. Number two rubrics that you should think about is about what is common between the child and the mother. Okay. That is the attention seeking. Very attention seeking and a feeling of abandonment, forsaken. Very restless, extremely restless. Restless children. The other thing, the child gets angry, strikes people, striking, likes to travel desire to. You know? The mother had a lot of nausea during pregnancy. Sagria, natrum, ignatia, magnesium, how to differentiate? To find what is the exact individual symptom. And what is the individual symptom? Is that the child gets frequent boil, isn't it? So the main symptom of the case is this. Are you all with me? Can you see this? Eruptions, boils, recurrent in children disposition to. And can you imagine what's the remedy? Can you imagine what's the remedy? Okay, so you can see this here. Oh, okay. All right, here we go. So can you imagine what the remedy is? For that, we'll have to open the rubric. Eruption, boil, children predisposition to. And there is only single remedy. Magnesium carbonicum. See the exact single remedy. And now when you look at the entire repertory sheet, this is a absolutely beautiful case of magnesium carb. But you can see how we are so confident. We are not confused. Oh, it is staph. Oh, it is agaricus. Oh, it is exact. Are you able to see how we are able to build the picture? This is magnesium carbonicum. Magnesium carb also has the state of, especially you will see this in mothers' um, history in pregnancy, a feeling of strong feeling, as you know, of abandonment, of forsakenness, a feeling that they haven't got the care, love, nutrition. That makes magnesium carb and magnesium mu and magnesium sulf as very important remedies for autistic children, for hyperactive children, for ADHD children, where the mother's history during pregnancy has a lot of feeling of the kind of disappointment, a feeling of unlove, and very many divorces, that happen during the pregnancy or after pregnancy. Because of that, many children are probably magnesium salts. Interesting, no? I don't know. So magnesium carb. But I generally use in India, if I want to repeat the remedy very often, the potency that I use is LM1. So LM1 once a day, maybe for 7 days I would give, and then follow up every month, and then gradually I will build it up. If the state is there, I might give LM2 the next month and 3 the next month. And very beautifully the child improved. What happened within magnesium carb? First LM dose, the child started responding. First thing that you see, the eye contact started happening. The learning, he started learning new things. Now he started understanding things. He's able to laugh, he's able to cry on his own. Can you imagine a child who's autistic, who's mildly autistic, who's mildly ADHD, hyperactive, developmentally slow child, he's able to understand. Yeah. Beautiful. Next month I gave magnesium carb LM2. Now much better. He's able to respond on his own. He is able to laugh. He's able to cry. The aggressiveness has reduced. Interesting. There is a craving for carrot. Remember, magnesium carb has a lot of craving for greens and raw things. We've increased. So gradually, he's now 80% better within 6 months of treatment. And you can see in restlessness, lack of concentration, aggressiveness, learning ability, there is a remarkable change. And that's why in many cases of autism spectrum disorder, ADHD, aggressive, hyperactive children, homeopathy is such beautiful treatment which we have, where the homeopathic medicines act at much deeper level. The one thing I want to tell you is that not just the mother's state during pregnancy, but even the father's state before the conception are very important, probably affect the child and the child's behavior. So behavioral disorders, autistic children, ADHD, and there are some amazing results that we are having in homeopathy. The main thing is the case taking. In case taking, sometimes if you look at just the child's behavior, he's aggressive, he's striking, he's not making contact like this, you might think about, it's tuberculinum or something like that. But that's where when you really go at a deeper level, and that's where homeopathy, when you go at a deeper level and knock, and especially I go into mother's state during pregnancy. Recently, in one case of a child, a male child, mother's state during pregnancy, the state came out to be sepia, and the child improved so beautifully on sepia because the mother's state during pregnancy came up to be sepia. So the mother's state of mind, the physical symptoms during the pregnancy have such an important precedence that we have to give in homeopathy. And the results, once you base your prescription based on that, is absolutely clear. But prima facie, every child is special. And that is where, the difference between homeopathy and allopathy is that, in allopathy, there is medicines and there are toxicities, and you just keep giving, and they don't know what they are doing very often. The advantage with homeopathy is that, as you already know, it acts at such a deeper level. And probably, one great homeopath from India who recently left us, his name was Dr. Praful Vijaykar. And I remember one line by him that I'm very fond of. And he says that homeopathy is the only science in the entire world which accentuates nature. So it probably stimulates the natural way of healing. And that kind of stayed with me. Most of the other sciences are probably not accentuated the nature's law of healing. So I found it a very beautiful line that he said, and I realize day by day what it actually means. So I think that most of your patients, or most of the fathers, mothers who are having behavioral disorders in children, homeopathy is absolutely the choice.